Well, right now it is time that you take a listen. You take a listen to what we have to say because doctor is here for us. She's here to our rescue. A little bit on the doctor, just in case all of you want to go ahead and visit her. I think it is a perfect time to do something like that. This is going to do you a whole lot good. Let me tell you that Dr. Ratan Bhivaji Ajgaonkar is a caring and highly experienced dermatologist with over 15 years of expertise in treating a wide range of skin, hair, and nail conditions. Doctor, also speaks in English, Hindi, Marathi, allowing her to communicate comfortably with patients from diverse backgrounds. She provides safe, effective, and compassionate dermatology care for patients of all ages. Once again, Doctor, welcome to the show.
Thank you, and thank you for the welcome introduction.
Well, I'm just happy that you're from my part of the town. So this puts me at ease. One of the huge discussions these days that we seem to have with, or rather you seem to have with the patients is fungal infections becoming so common in the UAE. Could you tell us why?
Yeah, because see, this fungal infection, which is commonly referred as tinea infection, it is very common in UAE, primarily because of the region's hot and humid climate, which creates the perfect environment for the fungi to thrive. Actually, the high temperatures here, so it leads to the excessive sweating. And when this moisture is trapped against the skin, it allows the fungi to just thrive and multiply and flourish.
Okay, and is ringworm actually caused by a worm? If you can just help us understand this.
Yeah, no. Actually, see, this is a very misnomer because what happens when that tinea infection happens, we get red patches on our skin, so which has a border. So the border looks like a ring. So that's why people earlier thought that it was a worm inside the beneath the skin.
Even I
And
thought that.
yeah, I know. So that is the reason it is called ringworm.
All right, and how do you get these infections?
See, basically, there are many ways which we get. It is a very contagious disease. Okay, first of all, it is spread by direct contact. So, if you get to touch an infected person's rash or having any direct skin to skin contact, it can spread with that. Any contaminated objects like fomites, what we call. Okay, so sharing personal items like towels, brushes, hairbrushes, clothing, or bedding. Towels, brushes, hairbrushes, clothing, or bedding.
Hair brushes as well?
Yes, hairbrushes as well.
How does it get transferred?
Because it is spread by spores, exchange of fungal spores, and it is very contagious. Then, even by the animals, petting or grooming infected animals, especially cats, dogs, or any other livestock, can also get the infection in the weight. Plus, walking barefoot in moist communal areas like public showers, public toilets, locker rooms, or pool areas, that is also a source of infection.
All right, so everything that I probably have been doing is wrong. And now these infections, are they contagious? Is there a way you can treat them? What is the way forward, doctor?
Yeah, it is definitely contagious by all the ways which I told you. And so, moving forward, basically, we should never share personal items. That is one thing. We should wear very loose cotton clothes in the humid climate. That are the things. And just be hygienic. Take a proper shower, especially after sweating and all.
So again, usually people on their damp body would just wear the clothes without kind of wiping it dry. Or I'm talking about women especially. Going to the washroom. Yes, you do have a towel and everything that you use to wipe your essential areas, but that could also be detrimental. And it's been said use a tissue that could be more hygienic. Is it true?
Not tissue exactly, I can say yes, but it's very important to dry our skin after immediately after bath, because see, fungus grows in heat and moisture. If you're providing it, it will just enjoy that and flourish.
So how do I know that I'm infected or that I have any fungal infections? If you could just help me. This is just a broad area of understanding.
Yeah. See, basically, it starts with the itching, okay? Itching and some red raised areas will be there. Some boils will be there. It can start with boils and then it can spread like a ring like structure. So, whenever we see anything, any cream, any rash on your skin, any patch on your skin, just consult a dermatologist to get sure that it is not a fungal infection.
All right. And, what is the common mistakes that people make, especially when they think it's an infection or and they do not know that this is a fungal infection and this can spread?
Yeah, the basic common mistake which I think is diagnosing itself by AI. So That is what I would want them to go to the dermatologist. We have studied for lot many years to understand this and treat this. So I think you should visit a dermatologist and not visit any over the counter, not put any over the counter creams, because the over the counter creams are many times having steroids which will do harm and no good to you.
Okay, so I'll tell you one cream that usually most of us use is Fusidin.
Pandem also.
Pandem and Fusidin, right? Anything happens, just put Fusidin.
Yeah.
So is that good? Is that not good? I mean, does that suit everybody, or is it meant for a particular type of an infection?
See, Fusidin cream is an antibiotic cream. Okay, so that
Okay.
is meant for a bacterial infection and not the fungal infection basically. This is a fungal
So
infection.
please help me understand what is a bacterial infection and what is a fungal infection now.
Fungal infection is this tinea infection, what we call, and bacterial infection is caused by bacteria. So that will need an antibiotic, and this will need an antifungal creams to treat.
All right, and how long does that take to subside? And can you give us examples? Yes, here we're talking about ringworm. That is a fungal infection.
Fungal infection, yes.
What are the different types of fungal infections, and what are the different types of bacteria infections? Oh my gosh, I didn't know that.
Yeah, too much. See, bacterial infection can be a boil. Even acne is a bacterial infection. Okay, then any boils where you have, all this are bacterial infection, comes under bacterial infection. Any ulcers where you get many times, it is infected by the bacteria. And fungal infections are various types. It depends on the body parts which are affected. Okay, so if it affects our head, we call it tinea capitis. If it affects our bed area, then we call tinea barbae. That's why it is named according to the body part. If it is there on the body, we call it tinea corporis. If it is there on the foot, we call it athlete's foot. If it is there in the groins, we call this jock itch. So there are various ways. If it is on the hands, we call this tinea manum. If it is on the feet, we call it tinea pedis.
I wonder who has named them. I mean,
I
very,
know.
very intriguing. All right, so tell me, how long, doctor, should the treatment continue if it is a bacterial infection or if it is a fungal infection?
Yeah. See, if it is a bacterial infection, obviously we should take the treatment as long as a doctor tells, because he is the best person to judge how long we require it. For the fungal infection, generally what happens, we tell the patients to take the treatment at least for 2 to 3 months. Because what happens, even after the rash is gone, the fungi is still there in the deeper skin. So it is very important to apply the creams and take the tablets, whatever prescribed by the doctor, for a sufficient duration. Otherwise, it will just bounce back.
You know, in fact, I'm so happy that we're talking about this, because now the trend of doing a lot of laser has come forward as well, right? So say if I have an infection, or if I have a fungal infection,
Yeah.
can I still go ahead with my sessions, or I should stop immediately?
No, it will all depend on the severity of the lesions. Okay. So, and which body part is affected. If I'm having a tinea infection on the hand, if I'm doing laser on the other parts of the body, it's okay. We can go ahead with that. No problem.
And how safe are these?
It is safe. No problem.
All right. Now, for example, we are our own doctors, like you already said. What if I see all of the signs, say, of the fungal infection, bacterial infection all dying down? Can I stop the treatment, or is there a method that I have to complete the course even if it is not visible?
Yes, that is what the most important thing is. I would tell you that whenever the patient comes to us the first time, we tell us, "Ki don't stop the treatment till we tell you. You don't decide when to stop the treatment." That is what people do. They don't come even for the follow-up. If they stop itching, even the rash is there, they'll not come to us. That is not the right way, because we want them to treat fully so that it will not come back again. It will take time. At least the real infection which is there at that time, at least it should heal first.
So again, what does the follow-up do? You go to the doctor and you can just go and say, okay, have a look again at the rashes. But you, I'm sure, have seen follow-ups where people would have come with severe cases as well. Has that ever increased? Have you seen cases like that, because in between they were their own doctors and things went down south?
Yes. People try many creams and many wonderful treatments, what not. So my neighbor told me, my sister told me all these things. So I think they should just come to us and follow what we tell them and not the other friends.
All right, so why does bacterial infection or fungal infection keep coming back if I have treated it?
See, you feel you have treated it, but according to us, it should be sufficient treatment. That is very important. Okay. And if you have used over-the-counter cream, which are like steroid creams, so many a times what happens?
What are steroid creams? Can you help me
There
understand?
are a lot of steroid creams. I would not like to take the names,
Mm.
but
For-
steroid. What happen? Na? It will give you the temporary relief in the itchiness, but actually the fungi just multiplies in the deeper sections and it spreads wider. So what you will see, it will clear from the center and it will spread from the periphery. So it is just making a way out and just giving you that feeling that okay, you are fine only by the itching way, but actually the infection is spreading more, and it will cause more harm because it will be more resistant to treatment.
So what if it is not treated? All right. If say fungal infection and all your infections are not treated, what is the worst that can happen to you? And are there any prevention tips? Please, you've already scared me enough. Now help me.
Yeah. See, actually, if you don't treat, first of all, you will be a source of infection for others. That is the most important thing. You will be source of infection for your kids, for your spouse, and for your everyone who is around there, and sharing the same bedding, same clothing, everything, right? So first of all, and you will itch like mad. This fungal infections really itch like crazy. But the patients tell us, ma'am, we couldn't sleep for the whole night. That it's that bad. So actually, it's very important to treat the infection in time and for the sufficient duration.
All right. And what if the itching dies down, right? I mean, is there a way that I could reconsider my medication or the treatment?
Yeah, no, that is also one problem because the itching dies down, but that is just a symptomatic treatment. But clinical treatment, it is still there in your body. So you should apply the creams, you should take the treatment for more 2 to 4 weeks at least. We tell the patients that yes, continue doing that. At least the maintenance treatment has to be taken. That is very important.
All right. Now, what if, patient comes to you, say, at the wee hour, last hour, saying, I have tried, doctor, multiple creams, but it is just not improving. What is the first thing that you are most worried about? Because they have tried several creams, several brands, it's not working. What is it that you ask them immediately to do or maybe stop doing?
No, actually, see, the main important thing will be that he must have stopped his treatment too early. He must not have taken sufficient duration treatment, and also he might be using some reusing some infected clothes or beddings or whatever fomites he must have done. Because see, fungal infection patient, we always tell them to wash your clothes separately in a hot water cycle if possible, and also if there are any untreated family members, if they are not treated, they can get the infection from them. So it can be a ping pong infection. It will just go on from here to there.
You know, it's interesting that you say that. In fact, I have a huge issue with jeans. I do understand jeans is not to be washed every day, but I am crazy like that. I cannot rewear something the second day now. But I also know that fungal infections spread due to sweat, and if you wear the same thing over and over again, you're more prone to it. So talk to us about clothes, about hygiene as well. How can individuals keep themselves clean and to stay away from these fungal infections?
Yeah. First of all, hygiene is a very important issue. Okay. So we have to take bath daily. Very important. If possible, twice, I would say. At least once. So that is bare minimum. But I would suggest
take
twice
bath daily.
daily.
Please.
I get patients who say, "Ki no, ma'am, we just take bath alternate day." I'm like, how is it possible?
Why?
I don't know why. They're just lazy to take bath, maybe, or maybe to save the water bills in UAE.
Okay, thankfully I'm on the radio. That's why I'm quiet. But please, you go ahead. What
Yeah.
are the steps, doctor,
So
to be
basically,
hygiene?
see, we should take bath daily. Then keep your skin dry. Okay, pat dry after you come from shower. Apply good amount of moisturizer on your body. First layer always has to be a moisturizer. Then wear loose cotton clothes. And when you are having this fungal infection, try to avoid wearing tight clothes, because what happens, the moisture and sweat gets trapped beneath the tight clothes, and it increases infection, fungal infection. And it is the best environment which a fungus can have. So it just enjoys that. Plus, do not share your towels or personal items like toothbrushes, and toothbrushes also I'm telling, yes, and also
Why toothbrushes? I mean,
everything, whatever personal items you are, just avoid that. Just don't share.
and how long does
Hairbrushes
the
and towels and beddings and clothings, everything,
Right.
even nail clippers.
Okay, how long does this take to die down completely, the fungal infection? I mean, should the person be, if it is a couple, should that person be sleeping on another bed? How does it really work?
See, once you start the treatment, after 48 hours of the oral treatment, generally the infection becomes low. So that is why we say just start your infection as early as possible to reduce the contagiousness.
So I recently, came across a couple of pictures online, and I was reading about something where this gentleman's toes, the nails of the toes, they were discolored. Now, is that fungal infection, or
Discoloration of toenails can be
as in
various
it looked like
causes.
as if it was peeling? So I was kind
Yeah,
of.
it can be fungal infection, but there are other infections also, other things also in skin which can cause this brittle nails and some infection. So, but yes, we need to do the nail test and all to just understand what it is exactly.
So, doctor, is this that every time that, say, an individual has, say, a bacterial infection or a fungal infection, it will be visible on my skin, or Sometimes it's also naked to the eye. I don't understand.
Yeah, when it starts, naturally, many times it starts with little bit of itching and then the rash comes many times. So, but we say that patient is infectious many times, very early.
Very early. And does this only happen to a certain age group, or are children prone to it as well?
No, we have seen it from all ages, right from neonates, right from bachas to all oldies.
All right. And methods to, you already mentioned methods to stay hygiene. Anything else that you'd like to advise to our listeners right now that are listening to you?
Yeah, I would just say follow proper hygiene, keep your skin dry, pat dry yourself. And in summers, especially, I would tell them to be well hydrated and wear loose cotton clothes and not reuse the clothes again and again. Just wash the clothes daily, especially jeans, I would say. And when you're having this fungal infection, try to avoid jeans and tight clothing. That is very important. Which
What
we tell.
about detergents, doctor? Do they cause any irritants to the skin? Because, sometimes not all detergents can suit you. Is there something that we need to look out for?
That is something actually we cannot control. So I think that's okay. We can use any detergents, that is fine. But try to just change your undergarments also, especially after 3 months. Every 3 months.
I'm glad that we're having this discussion. I think high time that someone spoke about it. Doctor, we are transitioning from obviously the cooler weather to the hot, humid weather. Your piece of advice, obviously we're done with all the questions where the fungal infection was concerned, but your piece of advice as to how to stay hydrated, keep your skin glowing, your hair shiny, and stay healthy.
See, for that we have to have a proper nutrition, have a protein-rich nutrition, have good fruits, good vegetables, fresh fruits, fresh vegetables daily. And also, what happens with this air conditioning? Actually, there is constant shifts between the humid outdoor heat and cold, dry AC. So actually, it disturbs our skin's natural barrier and just makes it more vulnerable to all this fungal infection. So that is all, but we can't help it. So what we can do is we have a good nutrition and stay hygienic.
All right, and a bedtime routine or a morning routine for every individual that you must follow, come may what? What would that be?
I would say please take a proper bath and then pat dry yourself, then apply a good moisturizer.
Why does everything have to do with taking a shower?
I know, because we have patients sometimes who really stink.
Oh gosh, I'm so sorry. All right, but thank you, doctor. I mean, she is so candid. Absolutely love her for that. All right, another person sending in a question, doctor. One more thing, I have a problem with alcohol. So the person can't apparently use it.
I mean, he's allergic.
Probably.
So if he's allergic, then there is no way he has to avoid that, basically.
Is there anything else that he can substitute it with?
Yeah, there are non-alcoholic perfumes also, no? He can use that.
All right, there you go. That's the information for you on, 0586861003. You can also give us a call, 800-81003. But doctor, you have been a rock star. Absolutely loved this candid conversation with you. This is Dr. Ratan Bhivaji Ajgaonkar, specialist dermatologist in nationality. Well, she is from my neighbor. I mean, she is my neighbor. Languages, she speaks English, Hindi, Marathi, NMC Medical Centre, Nahda, Sharjah. You are fabulous.
Thanks a lot.
Well, more conversations lined up for you. All you have to do is literally keep it locked to Talk 100.3. Be part of the Fun Asia Network. I will give you more details as to how you can meet the doctor. A lot of questions coming in. How can we meet the doctor? I will send you the link shortly. I will see you in just a bit from now. Do stay tuned.
This is Talk 100.3. Henna Speedy Hair Colour, covering the changes in the world and covering changes in your hair right now. This is Fan Network News from the BBC.
BBC News with Chris Barrow. As the civil war in Sudan enters its fourth year, donors are meeting in Berlin to discuss ways to mobilise aid and revive peace talks. The conflict has displaced more than 12 million people. The US Vice President J.D. Vance has said he believes that Iran's negotiators want to make a deal,